you should type them in the Q&A box. We'll try to focus them all in the Q&A box. If they're in the chat box, that's fine too. We'll answer everything at the end. And after the presentation, you can expect an email from me with your certificate participation and that reference list. So yeah, with that, I'll turn it over to Marissa. But for the meantime, I think everyone should have my email address. So, all right, we'll get started. Go ahead.
All right, thank you, Megan. So like Megan said, my name is Marissa Meshulam. We'll get into a little bit more about me on the next slide, but today we are going to talk about incorporating mindfulness in the nutrition care process. As many of us are aware, as dietitians, there's been really a movement, I would say it's gained a lot of momentum in the past like 5-ish years away from traditional dieting and diet culture. And there's been a few other movements that's opened up with that, mindful eating being one of them. So hopefully, later on, we're going to get more into this, but you're going to learn a little bit and you can bring this into your own practice today. So before we get started, just a little bit of background on me. Like I said, my name is Marissa Meshulam. I'm a registered dietitian nutritionist, currently living and practicing now virtually, but here in New York City. I got my bachelor's degree from the University of Wisconsin in nutrition and public health. I then went on to NYU where I completed my master's and I did my dietetic internship through the Bronx VA hospital. After graduating from NYU, I went on to work at Mount Sinai Beth Israel here in New York City as a clinical dietitian there. At Beth Israel, it's a pretty small hospital, so I was able to cross-cover all units, which is really cool as a clinical RD because you get to see a little bit of everything. The truth is, the more and more I worked clinically, the more interested I got in understanding why patients are eating. So, so much of what you do clinically is what they're eating. And the more I thought about it, I was like, why are these patients eating? What's their motivation? And I really wanted to understand more of the psychology behind it. That ultimately led me to studying more on mindful eating and opening up my own practice, which is what I work in now full-time, MPM Nutrition. So I call it a nutrition consulting practice. I do individual sessions with clients. I do a lot of corporate wellness events, and I do some brand consulting on the side. As you'll start to see as we go into this today, I take a very non-restrictive approach to food. I think there's a lot of complicated things going on in most of our worlds, especially right now, that I help my clients kind of get away from all of the dieting and all of that and make food easy and enjoyable again. So let us get started. So our learning objectives of today, what I want you to be able to do by the time this conversation is over. So hopefully you'll be able to define mindful eating, understand the research behind and the clinical applications to mindful eating, and ultimately I want you to be able to apply some of what you learned today in your own dietetics practice. So just a little bit of a disclaimer. Today we are focusing on mindful eating, which is different than intuitive eating. I think the best way to highlight this difference is a quote from Evelyn Tribole herself, one of the founders of intuitive eating. And she said, mindful eating is a process of paying attention on purpose to your actual eating experience without judgment. I consider intuitive eating a broader philosophy, which includes physical activity for the sake of feeling good, rejecting the diet mentality, using nutrition information without judgment, and respecting your body regardless of how you feel about its shape. So to me, both mindful and intuitive eating aren't focused on changing the amount or types of food you're eating, but rather encourage you to look inward at how food actually makes you feel. I see them as both weight inclusive and movements away from traditional dieting. Traditional dieting implies you are being good or bad, whereas mindful eating and intuitive eating are more flexible practices. You can think of mindful eating as part of intuitive eating, but intuitive eating is a much broader philosophy where they touch on other points about like exercise and other principles. So today we are looking specifically at mindful eating, which is part of being an intuitive eater, but it's not as broad of a concept. Before we hop into what is mindful eating, I want us to take a moment to think about the way we eat today here in the US. What I am seeing with most of my clients, as well as friends and family, is that we're typically eating while doing other things. Breakfast tends to happen as you run off to work. Maybe you grab a quick protein bar or a smoothie as you commute. Lunch is then in front of your computer while you're answering emails, and the most of us come home from work extremely exhausted, and we like to unwind with TV and dinner. The most common theme here is that we are no longer paying attention to our food. This is a stark difference in American culture compared to other countries. One in particular I always think about is Italy. In Italy, they're eating pasta, aka white carbs that are feared in America for most meals. But despite what they are eating, they are a metabolically healthier country than us. So the question is, what is happening here? And the stark difference is the way in which they are eating. They are sitting down for meal times and enjoying their food. They're taking breaks from work to monotask on just eating. And that is something that rarely occurs for us here. So, what are the potential problems with the way we eat today? First and foremost, we're out of touch with hunger and fullness cues. Have you ever noticed that now you eat according to the clock versus when you feel your stomach grumbling? So the clock says 12:30, it must be time for lunch, or 4 p.m., guess it means I need a snack. We let societal standards guide most of our meals rather than using our own internal cues. Secondly, we are all engaging in distracted eating. When we eat distracted, we don't pay much attention to the food going in. And by doing so, we need more food to satisfy us. Thirdly, we are all looking for a quick fix, which tends to mean we choose convenience foods and don't give much thought to the quality of our food. All of these things lead us to overeat. A recent study found that using media, specifically smartphone usage during meals, led to a 15% increase in calories during that said meal. So just scrolling through your phone can lead you to eat 15% more calories. That is really a huge difference. And what happens when you overeat? We tend to gain weight. And what is our response to weight gain in America? We go on a diet, and it creates this cycle. We will address why diets don't work in the next slide, but helping your clients adapt mindfulness is a way to say goodbye to diet culture forever. So it is important that we do understand why weight loss diets don't work. Firstly, I want you to think about our hunter-gatherer ancestors. They didn't know when their next meal was coming from. So at that time, it was advantageous to be able to hold on to our weight. As a result of this, our bodies then adapted to hold on to fuel. Now, while this was beneficial adaptation in the past, most of us, if we're lucky, live in a world of abundance today where food is plentiful. Despite these environmental changes, our biology is still working against us when it comes to weight loss. When you go through a phase of strict restriction, aka most weight loss diets, our hunger fullness hormones change. We have decreased leptin and increased ghrelin, shifting us into a constant state of hunger. Additionally, weight loss diets tend to be a quick fix to a long-term problem. Instead of meeting you where you're at, they tend to be one size fits all. This is an issue when you adapt a diet plan that isn't aligned with your long-term lifestyle, because the benefits tend to be as fleeting as you being able to follow it. For instance, while keto might help you shed weight initially, if you regain all the weight when you go back to eating foods you enjoy, aka carbs, then keto never really works for you in the first place. We know that learning how to adapt healthy habits for life is key to maintaining health. Not only are these diets not helping you adapt healthy, sustainable habits, but they also encourage you to develop disordered eating habits. Research has shown that history of dieting is a key predictor in future disordered eating. One reason why diet culture is so successful in keeping people around is that the nature of it keeps you on the hamster wheel, known as the restriction binge cycle, as you can see in the image to the right. Diets encourage you to restrict your food, which then lead to intense cravings. What happens when cravings get to be too much? We tend to binge on them. Then we feel really guilty about the binge. So what is our response to it? We try another diet. So these diets are keeping you around by making you feel like you keep failing. And research has found that history of dieting significantly predicted future weight gain. Not to mention, this yo-yo dieting can cause detrimental metabolic effects. When you lose weight, even modest amounts of that weight regain, 2 to 6%, can cause plasma lipids, blood pressure, fasting glucose, and insulin concentrations to revert back to baseline or beyond. Lastly, dieting takes all the fun out of eating. Food is such an important social for social interactions, and for cultural needs. It should not be stressful. So mindful eating is the end to this diet cycle once and for all. Now we know diets are not the answer, so what is our alternative? That is where mindful eating comes in. This slide is from the Center for Mindful Eating, and I think they do a great job at summarizing what mindful eating is. I like to think of mindful eating as being aware of the food we're eating, being present and showing up for meals and giving it your full attention. It's about allowing yourself to become aware of the positive and nurturing opportunities that are available through food preparation and consumption, and respecting your inner wisdom. It's about choosing to eat food that is both pleasing and nourishing, and actually using your senses. Mindful eating is not about judgment. It encourages you to think about how food makes you feel. It really emphasizes listening to your internal cues to guide eating. To me, mindful eating is about making conscious food choices, identifying the differences between physical and psychological hunger, and learning satiety cues, and ultimately learning to eat in response to those cues. I really enjoy this quote, and I think it sums it up quite nicely. Mindful eating is the act of eating while being in a state of non-judgmental awareness, shifting one's attention to the food and mind-body connection. The image on the right is from Nutrition Strip's Instagram account, Mikkel, another registered dietitian, and I absolutely love the way she summarized this. So mindful eating is about what you're eating, as is every other diet, but it's also about why you're eating and how you are eating. So how does this actually translate into eating habits? Well, someone who eats mindfully acknowledges that there is no right or wrong. A mindful eater ditches the black and white thinking that we see associated with diet culture. A mindful eater knows that their diet is unique. They understand that they have individual needs and get rid of the idea of a one-size-fits-all approach. A mindful eater knows that their needs vary moment to moment. I always say to my clients that I'm explaining this to, think of a toddler. One day they eat one bite of peanut butter and jelly, and the next day they could eat 2 full sandwiches. They are the ultimate mindful eaters. Part of mindful eating is knowing how you feel when you don't eat mindfully. And lastly, a mindful eater can look at the world of food choices outside just themselves. They see the interconnection of their food choices on the earth and others. Now that we know what mindful eating is and the characteristics of mindful eaters, it is important to assess the research on this. After all, we are all RDs here who are trained in using evidence-based practice. So let's dive into what the research actually says. One of the main benefits of mindful eating has been its association with improved digestion. So we know that chronic stress can lead to disruption in GI function. Not to mention, weight loss diets induce chronic stress on the body. Mindfulness is a stress reduction intervention due to its ability to promote parasympathetic nervous system dominance. We'll explore this further on the next slide. We also believe mindfulness has positive impacts on digestion due to its encouragement to slow us down at meals. When we eat slower, we chew more. Given that digestion starts in the mouth, by chewing more, we are making digestion much easier on the rest of our GI tract. Research has found that when we do not focus on our eating, we do not digest our food as well. This can lead to gas, bloating, and discomfort. There is plenty of research to support the use of mindfulness in IBS patients. I was actually first introduced to mindful eating while working at a GI clinic during my internship. Many patients there responded favorably to mindfulness-based stress reduction, such as diaphragmatic breathing, body scan meditation, as well as just simply changing their eating speed. So just a little bit more of an explanation on how stress, digestion, mindfulness is all connected. This image characterizes the interaction between digestion and nervous systems and how stress impairs digestive function. We can see that stress impairs GI function by altering motility, decreasing blood flow to the GI tract, impairing nutrient utilization, increasing intestinal permeability, and increasing the sympathetic or fight or flight nervous system dominance. Mindfulness can then come in and promote parasympathetic nervous system dominance, that whole rest and digest function, which in turn improves digestion. Mindful eating also has known benefits for binge and emotional eating. Binge eating is characterized by a consumption of large amounts of foods and loss of control over eating, whereas emotional eating is characterized by consumption of food in response to emotional arousal. Research supports mindfulness based interventions to reduce the frequency of both binge and emotional eating. Binge and emotional eating are both typically thought of as maladaptations to stress. And since we know mindfulness addresses the stress, it creates greater self efficacy in coping with stress and negative emotions without using food. Research has also examined how mindfulness can play a role in reducing risk factors for chronic diseases such as cardiovascular disease, diabetes, and CKD. For cardiovascular disease, we know that smoking is a huge risk factor. Mindfulness education has been shown to improve 4 months abstinent rates up to 31%, whereas controls were only 5% abstinent rates after 4 months. For diabetes management, mindfulness training, in addition to diet education, is shown to have a greater result of improvement of glucose regulation than just diet education alone. Mindfulness-based approaches have also been shown to improve depressive symptoms, anxiety, well-being, diabetes-related stress, and health-related quality of life in diabetic patients. For CKD specifically, a study found that 14 minutes of mindfulness meditation reduced blood pressure and heart rate significantly compared to just standard diet education alone. What this all tells us is that mindfulness is a great addition to health and nutrition education to reduce the risk factors for many chronic diseases. It can also serve as a great tool for extra management of chronic disease-related symptoms for our patients. This quote was taken from a feasibility study looking at mindful eating in CKD patients pre-dialysis, and I think it kind of sums it up well, how it can be used as an in addition to. So, since taste and pleasure are important in our food choices, and CKD dietary recommendations can be perceived as restrictive and unpalatable, mindful eating was used to enhance eating experiences and cope with dietary recommendations. The mindful eating meditations focus on increasing one's awareness of body cues. Mindful eating interventions have successfully led to weight loss and decreased caloric and fat intake in perimenopausal women, and decreased sugar consumption and improved fasting glucose levels in individuals with obesity. Now, I already mentioned that weight loss is not a goal of mindful eating, but I think it's important to look at what the research says here, and it's something that individuals, especially clients and patients, are always going to be interested in. The theory with why it would be helpful with weight management is when you tune into satisfaction more and actually pay attention to your meals, you end up needing less food to satisfy you. The truth of the matter is, the research here is pretty mixed. In terms of obese populations, there is evidence that suggests that introducing mindfulness can help with weight maintenance versus allowing weight to continue to uptrend. There is some evidence that suggests it might be a tool for weight loss in those in a normal BMI category. Many researchers propose that if you do lose weight with mindful eating, that weight might actually stay off longer than it would if you followed a different diet. But as most things with nutrition research, we do need more longer, in-depth studies to cover this. The way I look at it is I always tell clients, if you're truly listening to your body, your weight will settle where it should be. You don't adapt mindfulness for weight loss. You adapt mindfulness to improve your relationship with food and stop the weight cycling that we see with other diets. This is a quote from an article addressing mindful eating effects on weight management. It states, "Increasing mindful eating has been shown to be successful in helping participants gain awareness of their bodies, be more in tune to hunger and satiety, recognize external cues to eat, gain self-compassion, decrease food cravings, decrease factors associated with problematic eating, and decrease reward-driven eating." I share these rewards with all of my clients/patients when I'm helping them develop a more mindful relationship with food. By improving on all of these things, healthy behaviors are improved, as is health outcomes, independent of weight change. So I think that's really important to remember. As we can see here, mindful eating is associated with decreased BMI, decreased portion size, decreased binge eating, decreased emotional eating, and most importantly, associated with improvement in well-being. Mental well-being is something so often overlooked in traditional dieting and nutrition prescriptions. Encouraging mindfulness is a perfect way to start increasing the mental well-being of your patients, as well as the physical, which is what we are already working on. Now that we understand how mindful eating can benefit our patients, the real question is, how do we start incorporating this into the nutrition care process? In terms of assessment, you want to see if your patient has a history of dieting or weight cycling. Maybe they have a history of binge eating, or if they are overall struggling to find confidence in dietary changes. We want to see if they are struggling with any GI problems and really ask them about their eating behavior. Where do they normally eat? Are they fast eaters or slow eaters? Do they watch TV while eating? If they are someone struggling with stress, they can likely benefit from this as well. Finding out all this information in the assessment to see how mindfulness can help improve their well-being is so important. Then next, in terms of diagnosis, some things that might apply here are like poor nutrition quality of life, lack of nutrition knowledge, altered GI function, limited adherence to nutrition-related recommendations. Maybe there's someone that is exhausted of dieting and overwhelmed by it, so maybe they've given up. If they are someone with a history of binge eating, we know that this population that can definitely benefit from all of this. We're going to highlight intervention and monitoring as we continue on, but those are the main things I do want you to think about when we think about assessment and diagnosis in the nutrition care process. So in terms of intervention, there are really two ways it can be introduced into a patient's life. There are mindfulness-based interventions such as meditation practices, stretching, yoga, which are basically basic exercises when someone thinks of being mindful. Then there are eating-specific approaches known as mindfulness-based eating awareness training. This applies all of the MBI practices to eating and awareness of those eating-related cues. So the MBEAT includes traditional mindfulness meditation techniques as well as guided meditation practices to address eating-related self-regulatory processes, including emotional versus physical hunger triggers. They'll talk about gastric and sensory-specific satiety, which I'll get into on the next slide. They will talk about food choice and emotional regulation pertinent to self-concept and stress management. Here's an example of how you can structure an MBEAT training program. So this is a group therapy example. So they start off by introducing self-regulation the first week. They have the patients try the infamous raisin exercise, which is the mindful eating exercise that we all think of. Then you continually build on those concepts as the weeks go on. So you try the mindful eating exercise with other foods. Maybe this example has cheese and crackers, which is more applicable to their daily life than a single raisin. Then you work through cues and triggers. So it teaches you about sensory-specific satiety. This is the concept that taste buds decrease their sensitivity to taste after relatively small amounts of a particular food. It helps with tuning into the immediate experience of taste, then noticing whether the pleasure or satisfaction from a food starts to decrease. It can assist individuals to maximize pleasure from eating smaller portions, even of favorite foods. By adapting the concept of sensory-specific satiety, individuals learn to notice their taste buds becoming satiated, to reevaluate their actually liking or wanting patterns, and to interrupt the typical restraint, craving, binging cycle. MBEAT also incorporates forgiveness. It's important to teach skills of how to handle things when you don't behave as mindfully. As I said, this is a flexible practice and non-judgmental is the most important part. It encourages individuals to highlight their inner wisdom and concludes with a discussion on where to go from here. So teaching them how to continually incorporate what they have learned. Again, I'm bringing up this image. So when we think about how we want to incorporate mindful eating into our patients' interventions, I want you to think about it in 3 parts. We are going to discuss with them what they are eating. We are going to address with them why they are eating. And we are going to figure out with them how they are eating. So starting with what you are eating. We want to empower our patients to make conscious food choices. This starts with knowing where your food comes from. In the past, people had to work very hard for what was on their plate. Whereas today, access to food, for the most part, if we are lucky, is quicker and easier. By taking some ownership in where your food is coming from, it gives you appreciation for what is actually on your plate. Next, we want to use your senses to really ask yourself and decide what you are in the mood for. While mindful eating encourages you to know what you are in the mood for, it also encourages you to know what is nutritionally sound. So mindful eating is not craving mac and cheese for every meal and eating it. When we truly listen to our body and feed ourselves what is good for us, we tend to crave those foods. So mindful eating is knowing that a veggie bowl with grilled chicken and avocado is a balanced lunch and will keep you fuller and more energized for longer than the mac and cheese alone. Mindful eating is also letting go of judgment. So on the days when the mac and cheese is lunch, there's no guilt around that. You enjoy it and you move on. So part of making conscious food choices is understanding our hunger a little bit better. We have two types of hunger. I like to think about it as physical and psychological hunger. Physical is eating lunch because you're starving, whereas psychological is eating because you had a bad day at work. Our physical hunger is more gradual. It tends to be open to different foods, and it's really based on the stomach. Whereas psychological hunger tends to be a more sudden craving. Sometimes it's for a specific food, and I kind of think about it as above neck hunger, and it typically doesn't respond, or you don't stop eating in response to, fullness because it's not usually about that. So you tend to eat past the point of fullness a lot. So I like to use the hunger fullness scale with clients. I find it as a useful tool to help you identify if you are eating for hunger or not. On this scale, 1 is absolutely starving, and then 10 would be absolutely sickly full. I call it like post Super Bowl kind of feeling. Our goal is to stay between a 3 and a 7 throughout the day. I always tell my clients, use the scale as information. If you're always getting to lunch at a 2, maybe you need a mid-morning snack, or maybe lunch needs to be an hour earlier. Or if you're out to eat a meal and you're going in at a 4 or 5, maybe you don't need as much food as you normally would. And lastly, if you're ending all meals at a 9, maybe you aren't balancing them as well as you should be. So it gives you really good information, and I find that clients really like working with this and thinking about how their meals are satisfying them. Ultimately, the goal of mindful eating is learning to eat in response to these cues we just talked about. We want to pay attention to how food makes you feel. Does a cheeseburger and fries at lunch leave you lethargic for the rest of the day? Does a salad without a starchy carb or grain leave you hungry an hour later? The goal of food is to make you feel energized while always enjoying what you are having. So we want patients to start reflecting on this and how their food choices are making them feel. And of course, there is room for those foods that don't make you feel as physically good. We just are doing it consciously. So I'm sure you're all wondering, how can we apply this to a patient with dietary restrictions? For example, a CKD patient or someone with celiac disease, there are foods that these patients need to restrict for a medical necessity. Mindful eating is never about forgoing nutrition education. It's rather about balancing being in touch with your body with nutrition education. The way I see it is a patient with celiac is not going to feel good eating gluten, whereas a CKD patient who is consuming high phos or potassium foods is going to feel negative effects of these lab values. We want to use mindful eating to enhance a patient's relationship with food in their diet. This can help with stress management, GI concerns, and binging that can all be a result of restrictive diets. Mindful eating can help those feel good about what they are able to eat. With these restricted patients, we want to help them balance their inner and outer wisdom. Inner wisdom refers to the hunger fullness scale, our taste preferences, our satisfaction, whereas I think about outer wisdom as our general nutrition education. It's important to note that sometimes illnesses can disrupt our inner wisdom. With a cancer patient, for example, many times they lose their appetite, aka their inner wisdom. That is when we rely on more of our outer wisdom, right? We know that they are in a catabolic state and need protein and calories to guide their meals. I had a client the other day who went through a period of extreme stress last week and lost her appetite completely. She was confused on if she should still try to eat because she had been working so much on using her inner wisdom to guide meals with me. I explained to her that sometimes we do need to use our general knowledge to override our inner cues if we are stressed or sick, these can really throw off our inner guide. I explained to her that she knows she still needs calories and protein, even if she's stressed, so that using her outer wisdom to guide meals can be helpful sometimes. Mindful eating is a true dance between your inner and outer wisdom. When you are guiding a patient through mindful eating, these are some of the exercise I like to use. So it's important to note this is from like my own clinical practice. So if any of you have other things that you like to use, I would love to learn from you as well. And please share those in the chat box so we can all learn together. First and foremost, I like to encourage daily meditation. The more mindful we can get a patient to be in other aspects of life, the easier it is to apply those principles to food. I like to do the mindful eating exercise with all clients and have a session where we really dive into how this is different than how they typically eat. After we do that exercise, I normally then encourage my clients to set a mindful date with themselves, which means that they schedule in one meal the following week where they incorporate what they learned from the exercise. They then journal about their experience. We come back to it and we talk about it. I challenge my patients to begin thinking about where their food came from by having them pick one meal and finding out where the origins of everything are from. And the answer is not Trader Joe's, right? We are getting way deeper than that. Where did that banana come from? So, for instance, it can be their breakfast, right? So they choose oatmeal with peanut butter and banana. I want them to find out where everything came from, even down to the cinnamon that they add. It can be a really fun way to get more curious about our food system and maybe encourage them to eat more locally or think deeper about the foods that they choose. This exercise ultimately can improve our food quality that we are choosing. For my fast eaters, I work with them on 3 deep breaths prior to mealtime. This mini meditation and gratitude break, and it prevents you from diving into your food without thought. It serves as a great reminder to slow down. So this next one tends to be hard, but I do encourage my clients to try to incorporate more distraction-free meals. Turning off the TV, put away your emails for a few minutes, place your cell phone face down. This can be huge in increasing mindfulness during meal times. Lastly, I love doing a food and mood journal with a hunger fullness scale. I have my patients include how they are feeling in their body, what their mood is like, how hungry they are pre and post meal. This provides so much more information than a standard food journal does. And I see it as a great way to see how emotions are affecting food intake and how satisfying certain meals actually are. These are all great tools you can use with yourself and with your clients to help them incorporating more mindful eating practices. And again, if you guys have any other things that you do, I'd love to hear from you too. So in terms of monitoring and evaluating, there's many ways you can check in on clients' progress. First and foremost, you can use the MEQ, or the Mindful Eating Questionnaire, which provides different subset scores on mindfulness, such as awareness, emotional eating, distraction, etc., to really assess if your patient has some problem area you want to continue to develop. You can also do this upon your first meeting and then upon your last, so you can see, or like middle, like halfway through your sessions together, so you can see how they're, improving. We also want to consider basic quality of life measures, given we know that mindfulness's greatest strength is in stress reduction. You can use the MSQ, which assesses symptoms of many different parts of the body, digestion, head, emotions, skin, etc., to see how your patients are doing overall in terms of well-being. You can simply assess the frequency of binge or emotional eating, just noting that they are binging so much less or having bouts of emotional eating so much less. You can address their confidence or self-efficacy. This is a huge thing that we see improving with mindful eating. You could have them count the number of times a week they ate without their phone out or without distraction. All these tools serve as a way to assess how your patient is feeling in their bodies, and the goal is ultimately to make them feel better. So I want to end on why mindfulness. I always tell my patients that they need to know their why. If you don't know why you are doing something, you are less likely to continue doing it. So why mindfulness? And the answer that I find here is confidence. This is an Instagram taken from the Center of Mindful Eating, and I think they do a really good job at showing this. Weight loss and validation from others, which are the results of typical diet culture, provide temporary confidence. well as healing your body image, accepting your body, finding self-worth outside your weight, and ditching comparison, aka recognizing that one size fits all approach do not work, is the key to long-term confidence and long-term success. Oh, sorry. So really, this is a tool to increase confidence in our patients, which so often goes away with these restrictive diets. Just some resources for all of you. I know that we are a largely kidney-based population out here. There was a book written by a fellow dietitian, Mindful Eating for a Pre-Dialysis Kidney Diet. I think that's definitely something to check out. Also, the Center for Mindful Eating has wonderful resources for practitioners. I find that they have a ton of great stuff. Their content is really great for you to look through and tools that you can use with clients. So I definitely recommend checking both of those out. All right, now I think we are going to do some questions.
Yeah, thanks, Marissa. This was a really informative presentation. So again, everyone, if you have questions, please type them in the Q&A box or the chat box, and I'll be monitoring. So far, we have a few. So Marissa, in your experience, do mindful practices work better as an early intervention, or is this more beneficial for clients to not seem to have the buy-in to the recommendations that you're making?
So I think it works better in both. I like to think of it always as an in addition like type therapy. So I'm never not providing nutrition education, right? I'm always talking with my clients about what is nutritionally sound. How are they, what kind of meals are going to give them the most energy? What kind of foods are good for their heart and are anti-inflammatory? People a lot of times, enjoy learning that too. So I always think that like this tool goes side by side with any nutrition intervention we are already doing. So I think it can work really well on both populations. The way I see it is that instead of just talking to your patient about what they're eating, you're also working through with them the why they're eating and the how they're eating all at the same time.
Yeah, great. Okay, the next one I have is some patients have significant health issues that need to be addressed, obviously, our chronic disease patients. Do you think this approach is too soft for patients with chronic conditions like diabetes or CKD or some of the GI issues that we have?
Yes, so that's a great question. I think with CKD and diabetes, there are significant, dietary changes that need to occur, right? So it can't be on its own in those patient populations. So I think it's an in addition to. I don't see it as too soft in any way. I think about it as it's, side by side therapy again. And the last thing you said was with GI patients. I actually think, and this is from, my own clinical experience, when I interned at the GI center, their like intervention, her first line, the dietitian there, and she was a genius, was just working with patients on their eating behaviors. And so many of them came back, and just by chewing more and eating slower, making their meals last longer, they didn't have to cut so many things out of their diet that we're constantly seeing with IBS patients. So I think that's really powerful.
Yeah, I agree. Okay, the next one is, what do you think about the barriers to mindful eating in CKD, such as significant history of noncompliance or limited awareness of the physical impacts of high potassium and phosphorus? And how would you address mindful eating with these types of patients?
Wait, so what was the question?
So we're looking at history of noncompliance or limited awareness of the physical impacts of having, high phos or potassium.
Yeah. See, I think a lot of those patients who aren't aware of the impacts are kind of in that pre-contemplative state and reject a lot of nutrition education. And I kind of think this can be a way to simultaneously like get them more interested in their food again. This talked like that quote that I had from one of those review articles on CKD. The issue with the CKD diet sometimes is that patients think it has to become unpalatable, right? We're telling them to reduce sodium, get rid of so many limit so many of these like vegetables that they would normally be eating. So patients get like really confused. So I kind of think this is a way to promote confidence again in your CKD patient.
Yeah, and kind of another question related, in a if there's a patient who has a history of non-compliance, do you think this can sort of bridge the gap? Do you see this as a useful tool for a patient like that?
Definitely. Because I think sometimes patients get like a lot of those who are on these like crazy restrictive diets, or they feel that it's crazy restrictive, they lose their confidence in the ability to make changes. And mindful eating gives them their confidence back again, in the sense that like they have some autonomy here, right? They can look at their meals and seeing how they're satisfying them. It's fun to like taste things again and actually get curious about if you're enjoying it. I think that that's something that people stop asking. You know, when a patient's on a restrictive diet for so long, people stop asking, are you enjoying your meals? And I think asking a patient that, which you do through mindful eating, can be really powerful for them.
Yeah, we have another question kind of related to that is, if you're in a clinical setting, even if it's not totally like inpatient clinical, but a dialysis center or an outpatient hospital setting, do you think that there is a way to include this, when you have so many patients, or is it something that requires more time?
Yeah, I think that's a really good question. You know, I did work clinically for some time. I think it's harder. I think because you do need the time to explain that to someone usually, and you need to know more about them, more about their eating history, right? More than we normally know during um, a quick visit in the hospital. But I think, we all get like those random few patients on the days when we have the time that really want to sit and listen. And if you do have a patient, maybe someone who's really struggling with GI stuff or just like low self efficacy in their diet, start talking to them about like hunger fullness. I find that that can be a really fun one to use with people. Just show them an image of the hunger fullness scale and be like, have you ever thought about this before you're eating your meals or once you finish, or, and I think that can be a nice way that you can like quickly show them some stuff clinically. I do believe that the Academy has some handouts on mindful eating. I could be very wrong, but I would check out and see if they do have stuff maybe that you can use in your hospital that you could at least like hand out to a patient and briefly go over with them to introduce them to the idea.
Yeah. Yeah, and I'm curious actually of my own. Have you ever utilized this type of thing in a group setting, or if you have, do you find that it's more or less effective in group or individual setting?
Oh, I think group is so wonderful for this kind of stuff. We used to do groups at the VA hospital where we were interns, and people like really love talking about these things together because it gives you some sort of camaraderie. So like that example I had in here about like the MBEAT training and like how to incorporate that was a group setting, like example of how they did it in a study. And I think, if you have the ability at your hospital, whatever it is, to host groups about this, and even just support groups where you talk about things, maybe one week you do the exercise together and then you talk about it. Any of those exercises I had listed, that could be a really great thing.
Yeah. Okay. Many of my patients do not have a very good concept of what your body needs. For example, they've gone so long without much focus on how fruits and vegetables and other healthy foods make them feel, and they prioritize consuming large amounts of food during a meal. How do you handle this, and do you have a recommendation for easing into a mindful eating approach?
Okay, so the first part of the question was about like patients who just don't eat well, so don't know the benefits of it, kind of.
Yeah.
Okay, so that is like, I don't know why this just popped into my head, but when everyone went on the whole celery juice craze and they were like, oh, celery juice is so amazing. And all these people who were normally eating like McDonald's or Dunkin' Donuts for breakfast started drinking celery juice and felt like instantly better. So I
Yeah.
think that like, goes to show that like you can feel changes relatively quickly if you do something, right? So I do think that just maybe encouraging them to like take 3 days where you give them some meal examples, and okay, instead of a donut for breakfast, let's try to have 2 eggs and whatever, and like incorporating just a serving of veggies at lunch, right? So starting them off on like small changes and then really having them notice how small changes but over like a little bit of a time. So I want them to do like an actual day or three, right, where they are eating better, and have them come back and reflect on if anything changed, because usually it does. And even if it's things that they don't notice are tied to food, maybe they slept better, maybe they had less anxiety, less brain fog. Maybe they could work better throughout the afternoon because they weren't so full after lunch. Incorporating that kind of stuff can be really powerful. So like, I really don't think it takes that long to feel the difference of a change. You know, I think we all know from personal experience, right? We're not perfect. We've had days of not eating well, right? And sometimes after a weekend of it or a vacation where you just overdo it, you come back feeling not so great. Whereas on the other hand, then just one day of really awesome eating can make you feel great. So I think like trying to incorporate that. And then what was the second half of that question?
Do you have a recommendation for easing into this approach?
I think just do the mindful eating exercise, that raisin exercise. I prefer it with chocolate. The reason is because a lot of people, like, no one really cares for a raisin that strongly, but
Mhm.
people have very strong opinions on chocolate, and it reminds them of childhood in different ways. And a lot of people do the exercise and they're like, oh, I didn't like it the way I thought I liked it. So start with the exercise and just start talking about how is that different than what you normally eat.
Yeah, I remember when I was doing my master's program, we did it with a chocolate. We did like a Hershey Kiss and then a really expensive, like
Hmm.
rich chocolate from Europe, and it was a huge difference. And you don't realize when you're just, eating to eat something sweet, how the quality can affect your enjoyment and the whole experience. It's really surprising. So I encourage everyone to try that yourself too, actually, because it's kind of interesting when you think you're craving something. If you really sit down and eat it really, really slow and you smell it and you taste it, how it can really change your opinion of something.
I think I did it with like the dark chocolate Hershey Kisses in my class, and I realized I didn't like them,
Yeah.
which is like so weird because, you know, before I would have never thought twice. And I had a client yesterday, she actually had been recently like binging on cookies. And I was like, okay, like let's take one of these cookies and like let's do the exercise with it. And at the end of it, she was like, I didn't really like the cookie. And I was like, isn't that so interesting? And she actually texted me this morning. She's like, I hope you know I didn't even have a cookie last night. Like I had no interest in it. So I find that exercise to be really eye opening for people and just to like open the forum to the conversation of like, why is that different? What I also hear a lot is that most of us put food in our hands and we don't hold it. It immediately goes into our mouth. And then when it goes into our mouth, it's chewed and swallowed, right? Immediately. But the exercise makes you do a lot of different things with the food. And I find that to be really powerful.
Yeah. And actually, thinking back to the non-compliance questions, it kind of makes me think, if a patient's really struggling to follow your recommendations or they find, managing the different nutrients too confusing, I actually think this is a good kind of around, like, I don't know how to say it, like around the behind the back kind of approach, because they can, if you focus on portion size and mindfulness and really eating slowly, you can probably change a lot of behaviors that way. And that way you don't have to focus so much on the nutrients. In some ways, it might be easier for a patient with a history of noncompliance.
Exactly.
Great. All right. So I don't think we have any more questions. Again, everyone, thank you so much for joining. I'm going to be sending out the reference list and your certificates of participation after the presentation. Feel free to reach out to me with any questions you have. I'll also include Marissa's contact information and her website information so that you can check it out yourself. And it also, I would love to continue the discussion about some of these things. If you get to use them in your practice or anything that you find works for you and your patients, feel free to share with us. We always like to hear new things so we can help each other be better practitioners. So
Definitely reach out to me if like anything from this presentation was interesting to you and you want to talk about further. Like I'd love to continue the conversation with any of you.
yeah, for sure. I think the more we can help each other, the better, especially with restricted patients. So thank you so much. And with that, we will end it. But be in touch via email, everyone. Bye-bye.
Bye.